Hey everybody, welcome to Sound Bombing. I created this show for people who want to experience a radical, life-changing journey through the sounds of my diverse guests. I hope that each sound you hear on this show will strengthen your faith, encourage your dreams, and challenge you to awaken the greatness within you.
Drop the bomb. Drop the bomb. We're gonna drop the bomb. Drop the bomb. We're gonna drop the bomb. Drop the bomb. We come to drop the bomb. Drop the bomb.
This is a journey into sound. A journey which along the way will bring to you new color, new dimension, new values, and a new experience.
LaMarrr Shields.
Good morning, good afternoon, good evening, whatever the time of the day is. This is Sound Bombing, and I am your host, Dr. LaMarrr Shields, and I am always so excited that you decided to hang out with me because you could have been anywhere today, but you decided to come back, hang out with me, not because I am anybody that's special, but I think you're here because you heard that we have some of the most amazing guests that stopped by the bomb shelter to hang out with me. And I like to highlight these amazing people because folks are doing some great things, and especially during these tough times around COVID, around racial injustice, around health issues, around everything that's taking place. And so we bring on people to the show who are superstars or heroes and sheroes in their field. And just last week, Aura Martinez talked about self-care for yourself, and she talked about how we can sort of rejuvenate our mind, our spirit, our body. And today is no different. If you're new to the bomb shelter, yay, welcome, welcome, welcome. If you are old to the bomb shelter, you already know what time it is. If you are a member of our community, thank you for coming back. But we always started our show with our three breaths. So my guests want to get him prepared for this as before I introduce him. So what I would typically do, I would ask you all to put your feet on the floor, palms facing up, and we like to sort of set the foundation for this show with our breaths, just to say that we are here and to bring some positive energy into the space. And so what I want you to do is I want you to slowly close your eyes, and then we're going to take our first breath. So we're going to inhale, going to hold it for 3 seconds, and then exhale out of our mouths. 2 more breaths. Inhale, go a little deeper for 5 seconds. Exhale out of our mouths. Our last and final breath is going to be a deep breath, and we're going to go for 10 seconds. Inhale. And exhale. What do we call that, bombers? We call that the breath of life. And the breath of life says that we are here because I am so concerned about your well-being, and I'm sure you are with mine because you send me some of the best emails, some of the best tweets. Thanks for tuning into the show. But before we go any farther, I want to make sure that you subscribe to this podcast. We want to make sure you leave your comments and then stop being stingy and share me with all of your friends, not just me, but the amazing people that I bring onto the show. So let's get this party started. The healthcare system in the United States is uncoordinated and fragmented and emphasizes intervention rather than prevention and comprehensive health management. Healthcare costs continue to increase and at an unsustainable rate, and quality is far from ideal. Ensuring that all people in the United States and across the country have affordable healthcare coverage that provides a defined set of essential health benefits, or EHB, is necessary in order to move toward a healthier and more productive society. Additionally, our healthcare system must begin to account for and address social determinants that have profound impact on individual and population health outcomes and costs such as socioeconomic status, housing and occupational conditions, food security, and the environment. Our guest today, Dan Pelino, will talk to us about healthcare as a matter of human dignity. Let me say that again. As a matter of human dignity, that everyone is entitled to health care. Who is Dan? I'm so glad that you asked me because you're looking at him right now. Dan is an innovator. Did you hear me say that? An innovator, a thought leader, an author. He is a co-founder of Everyone Matters, Inc., a social impact enterprise dedicated to ensuring that everyone has the right to dignity and respect to be who they are without being shamed or demeaned, and to thrive within their own unique individuality. He worked for IBM for 36 years, leading its global healthcare life sciences business. For 10 years, he concluded his career with IBM as the general manager of the global government healthcare, education, and life sciences businesses. Dan is a co-author and trusted healer. He also works with Dr. Paul Grundy and the Global Healthcare Crusade. He is a regular contributor to every show that you can think of for CNN, Bloomberg, the BBC, and now he is hanging out with me in the bomb shelter. Dan, welcome to Sound Bombing. How are you?
I'm great. I'm honored to be in the bomb shelter. Yeah.
Hey, Dan, let our listeners know where you are calling from, and then let us know how you are doing, because I like to ask people how they're doing because this pandemic is driving many of us batty, and that's why I brought you in here, because you're talking about health and healthcare. Let us know where you're calling in from and how are you doing.
Well, I'm thrilled to be here. I'm doing well. I'm calling you from a little town in New York called Penn Yan, New York. It's on the most beautiful lake, Huka Lake, and we have a place here that's a little bit of a respite for us. And I've been kind of hanging out with all this going on, and I'm thrilled to be here in a beautiful setting. It's really laid back, and it's a great place to have a conversation with you today.
I've never been there. Now, I've been to New York. Is this upstate New York? Where is this?
Well, it's below Rochester and Syracuse in the Finger Lakes, which were created by the glaciers when they pulled back. They are beautiful lakes. They've got great wineries and terrific places to eat. You got to come here. Come visit.
Well, I am always, once this COVID pandemic slows down, believe me, I love nature. I've been to Rochester. I know it gets cold there. That's where that Genesee River is, which looks scary. That Genesee River, I don't know what color it is right now, Dan. Maybe you can share it with us. But I love that area. It's a place where, a quick history note, where there's a great statue of the great Frederick Douglass, who is from the Maryland area. He, of course, during that time, him and all these other abolitionists and folks who were fighting for slavery and the rights of all people, they moved in that direction. They went to Canada. So I've been in that area. I'm not a fan of the cold, Dan, even though I grew up in the great city of Chicago, man. It is just not a part of my DNA, but I love the outdoors. I love the beauty. And I love how you said this is a great place to start a conversation. So let's get this conversation started. Dan, there's a lot going on right now, man, around health and wellness, instability across the country, anxiety at an all-time high, not only just with young people, with adults. Kids are going back to the classroom, people trying to manage their homes with their kids, people being laid off. Dan, what strategies do you have for us to stay sane in this insane environment right now?
Yeah, and you're so right. There's so many things that are going on, and you probably know this. Mental and behavioral challenges are up, unlike we've ever seen before. People are struggling with things. They're actually afraid to go to the doctor because they're fearful somebody might be there with COVID or something. And anyway, it's quite a challenge. I will tell you, there's a lot of good things that people should know about that might be helpful to them. For instance, this telehealth stuff now, the fact that you can talk to a doctor, an RN, a PA, somebody about whatever's bothering you, ailing you, talking to your doctor, your primary care doctor, maybe somebody, even a specialty, and you can do it over the phone. And so, although that doesn't give you the opportunity to test you need or the blood work, but it does give you a chance to engage in a conversation about your health and maybe put you on a path that's helpful during this time.
So how did you become so passionate about health and healthcare across the globe? Where did this desire come from? Because I always tell people, if I can go back to school, Dan, I would probably become a health practitioner, maybe in a more homeopathic area. I'm so concerned about the things that we consume, that we put in our body, and being a person of color, when you look at the health rates and health disparities around people of color, I'm really, really concerned about that. So where did your passion from health and wellness come from?
Well, good for you to be thinking that way, for sure. I had a good opportunity with IBM. They asked me to run healthcare and life sciences business globally, which is a very significant business. You see, I'm a behavioral guy. I'm an organizational behavioral guy. I look in the gaps. I try and figure out how we create value. I think things differently. I'm not a doctor. I don't come from an insurance background, health insurance background, or even a pharma background. But I'm one of those guys that I like to look and try and see things differently and see if we can make a difference. And so with good fortune and some terrific people, I was given the opportunity to work with the best healthcare providers literally in the world, to the governments that were doing it the right way, the pharma companies that were trying to make a difference, the insurance companies that were trying to change it from an insurance company to a health-based insurance company. So my passion came from working with great leaders, including Dr. Paul Grundy, who's just a rock star in this space. And I came to this with my eyes wide open, knowing there were some challenges, working with some great people. And when I got done, they said, you know, you've had a chance to really look at things, and you don't have a dog in a fight. You're really more of a community builder. You're not a community owner. I don't own a hospital. I don't own an insurance company, but I happen to have these relationships and saw ways to do things. I saw where people did it really well. And that's why the book Trusted Healers.
So where are you seeing people doing it really well? So I'm hearing you say, I saw people doing it really well. Where are they doing it well? And what is the it that we're referring to?
Yeah, the it is this continuum of care where you have someone that is helping you navigate through healthcare. Let me give you an analogy. So in the past, it was often thought of that when you went to go see a doctor, you'd fill out obligatory clipboard with all sorts of information. It was sort of like a school pop quiz, you know. Mm-hmm. You'd fill out everything and you'd give it into somebody, it'd go on a folder, and then they'd put it up next to a door, and there'd be a knock on the door, and somebody would come in and say, hey, how are you today? Like they knew you, you know? And then they'd spend 5, 10, 15 minutes. And of course it was a challenge, a lot of things going on, and they usually wrote your prescription. And then they kind of rode out of town, right? They were gone, and unless you came back, but they weren't necessarily sticking with you on helping you think about things. Let me tell you, today is different. Today, we're all about, we're a NASCAR, we're a Formula One car, and we're in the race of our life. And what you and I want is we want a pit crew. We want a pit crew of RNs, PAs, specialty, et cetera, all wearing our colors that tell us when to come in for appointments, know our numbers, all that kind of stuff. And we come in, they get us back out, they get us well, and we're back out in that race of our life. And we have a team, and we know there's a team, a pit crew of people helping us with our health. And that's what we're talking about, this continuum of care, primary care, upfront care, moving from sick care to well care, and being able to offer that into individuals, families, and communities where you can make a difference.
So do you feel that we've moved in a phase where there's a pill for that? Because when you talk about healthcare and wellness, I see the healthcare piece, but I don't really see the wellness piece enough in the healthcare industry, because I'm seeing more and more people wanting a pill for this, wanting a shot for that, but not talking about overall wellness and being their own trusted healer, is a term that you somewhat use, that we're looking at somebody else to provide some things for us, and some of those things that we should be doing for ourselves.
Well, you're so right. And when you look at countries that have done better than we have, they spend 14 to 20% of their first dollar on well care, upfront preventative care. Countries like Denmark is a good example. There's many others that are well ahead of the U.S. You know, unfortunately, the U.S. is ranked 37th in the World Health Organization and what we do in delivering care. We only spend 5% of that first dollar on preventative care. We spend more of our dollars on sick care, specialty care, and end-of-life care. And what we talk about in the book is how do we reverse that? How do we take more accountability for upfront and preventative care? And what kind of conversations should we have with the doctors? And what should we be looking for and do in order so that we're more in the preventative care? And people that do that, they end up having a 15 to 20% less likelihood of having an emergency room event. They have a 30% less likely of a hospital stay. They pay 19% less than people that focus just on sick care. And this is the kind of care that you and I want. We want this continuum of care. We want this pit crew. We want to know that people know who we are and they know what our numbers are, just like we know them, and they help us get to a good position in our life so we can contribute to our society, so we can contribute to our families, and we can run the race, drive the race, be in the race of our life.
And see, that's the world that I would want us to live in. I don't know if we're there yet, because when I look at healthcare, I somewhat compare it to education. Is that we spend more money locking up children and young adults and putting them in these facilities instead of putting that upfront money where we know, because my background, I worked at the School of Public Health at Johns Hopkins, and also the School of Education. And so I'm looking at the money coming on the back end instead of just us investing in young people earlier, instead of us investing in young children health earlier. We put all the money on the back end instead of saying, these are some things that you can actually do. Let me give you an example. So what I've been doing in my house, this DEI work, everyone is quarantined. Yep. So everyone now, Dan, is taking on a new skill. So I had a CD rack. I had CDs, and some of my listeners probably out there don't know what the hell a CD is. And I'm not talking about financial, I'm talking about music. So I had a CD rack, and we're not playing CDs in my house. So I took the CDs out and I got these mason jars, and I added, in each mason jar, I added like medicinals like herbs and things of that nature, from peppermint to chia seeds, just a variety of different things. And I gave them, I printed out the labels and I gave them to my daughter, who's 17 years old. And I said, all right, I want you to put the labels on the jars. And then I'm going to go to the health food store and get some of the things to put in the jars. I learned this when I was in college years ago, and it just hit me. So when we came back, I asked her, what did she learn? And she says, I did not realize that there's so many things that comes from the planet, the earth, natural, that can heal our body. And I'm saying that to say that, and I'm not saying that medicine is not important, because this is not that conversation, but I'm saying it to say, as a father, I'm teaching my daughter at a very young age to be responsible for her own health and wellness. Not saying that she can't go in and get an aspirin or an Advil. It's not about that, but also understanding that there's some things that she can do right now. And that's just been my big concern when it comes to healthcare as well as education. And you said it as well. We're spending 5%, or maybe you said 5 cents out of a dollar when it comes to healthcare. What can we do to shift that as an individual practice for people that are out there? Because like you, I don't run a hospital. I don't have a healthcare system. I don't run a clinic. But what are some things that you can share with my listeners who want to take control of their healthcare, but then also be in tune with what's happening in the world of healthcare when they go see their DO? Like, I have a DO, I don't go to an MD, because I like my DO because he asks me tons of questions. He spends a lot of time with me going through my chart, having these conversations. Before my MD, it was just like I was in and out. And I understand the insurance game because I come from a family of insurance reps and things like that. So what are some things you can share with our audience members to be more responsible for their own health and well-being?
Well, first of all, you're doing a great job, because it's that health literacy piece that you talked about, that combination.
Health literacy, I love that. Never heard that.
So
I love that.
You're right on. So first of all, the idea that we as parents, or we as elders within our community, the idea to help with health literacy, because people do need help on this, and you're in an advanced stage. You're talking about herbs and other things that can be helpful to you. Some people just don't even know which way to turn for certain help. So in a way, you're acting as a trusted healer to your daughter, which is just wonderful. And I think that's a great role model, and others should try and do what you're doing there. Second, you really need to find a primary care doctor or a DO, someone that you're comfortable with, that you can go in and have this kind of conversation that we're having, and do the blood work and figure out what your numbers are, and know what your BMI is and what your cholesterol levels are. and look at your glucose levels and make sure you know what it's like and how you managing stress, and no nicotine in here. And heaven forbid, don't let these kids start vaping, because we've learned a lot. We've learned a lot over time. Some of this stuff starts to explode on us and we don't catch it fast enough. That's how we got in a problem with a lot of challenges with opioids. Opioids came out in the late 1990s, OxyContin, and it was under a mandate to do no harm, and doctors didn't initially think that it was addictive. And they would give people pills, 30, 60 pills. Well, guess what? It was addictive. And then when they got stripped of it, they ended up chasing down heroin. And then when heroin started to get a little tighter and people were starting to cause problems for you if you had heroin, which they should, that people snuck out and they went to fentanyl. And fentanyl, which is called Chinadol and other things on the street, this is a killer. You take just a little bit of powder of fentanyl and it'll wipe you out. This opioid challenge, it started about 30, 40 years ago under a do no harm, because we didn't have this literacy that you and I are talking about here. And we didn't have really trusted healers and the knowledge to stop people from going down a path where they were trying to control pain one way or another.
So let's unpack. Keep going.
I was just going to say, there's lessons that we've learned in the past. This is the societal change that I talk about in the book. And the good book, the Bible, talks about 40 years. It actually talks 146 times. They reference 40. And the reason is because it sometimes takes a generation. Ruth Bader Ginsburg just passed. And many people are talking about things that she said. And one of them is, what's the difference between a bookkeeper and a person that's a Supreme Court judge? And you know what she said? A generation. So we need to have a generation of people like you, so the next generation has that health literacy, so they take care of ourselves. And each and every one of your listeners that's listening, it'd be wonderful if they pick this up. They could read in the book, talk to people like you and say, what can I do? And it gets to be that individual view, and having a relationship with a doctor, a DO like you have, a primary care doc, an RN, a PA, where you know your numbers, you've got a plan, you're figuring out what you're trying to do, and then you share that with your family. And that starts to change generations and makes a significant difference.
I love it. I just wanted to, I jumped in for a second because I wanted to unpack that word a little more. I love that concept of, you said the health literacy, but there's another word that you talked about, which is trusted healer. Can you just talk about that a little more, what that term actually means? Yeah.
So many of us grew up with potentially a doctor that we knew that was in our life. As I'm talking to you, maybe your parents took you to a doctor that gave you the school shots and checked you out, et cetera.
Oh, man, you taking me back. I remember I was a sickly kid, man. I got shots. I got, for allergies, allergy tests. I mean, listen, that's why I had to change my lifestyle, because I remember just going, and my kids love going to see the doctor. I'm like, why do you love going to see your pediatrician? I love Dr. Jones. He was great, but I did not like going into that spot at all.
Yeah, I had Dr. Spector, man. I had Dr. Spector. So your listeners right now, they're all shouting out right now the name of their doctor. The name of the doctor. They're going, yeah, I know that person. So what's interesting is that was kind of a little bit in the history, right, of what that was like. But we didn't necessarily know our numbers. We almost didn't know why we were going in. We knew we were getting shot, et cetera, but there wasn't this continuum of care. There wasn't the information that was readily available. It's contained in the electronic medical records today, and information that we should carry, including mental and behavioral health. When I was on the Dr. Oz show, we talked about checkup from the neck up. We were talking about mental and behavioral health too. This isn't just the physical health side, right? This is also how you doing mentally, and what are the things that you're thinking about, and how can we help you think in a different way to make a difference in your life that way. It is that holistic approach that you mentioned earlier, and it starts with that relationship with a trusted healer that helps guide you through that process. I will also tell you, when I tell you about trusted healers, some of your listeners, I'm sure, are saying, my auntie, she was the trusted healer. No matter what the doc said, she rubbed us over with vapor rub. And she had, what was ever ailing us, like chicken soup or whatever. She made us eat or drink whatever it was. And she was actually the trusted healer.
Well, since you talked about your appearance on Dr. Oz, and I know there's a key part to healthcare, you mentioned in there, a key part to healthcare and wellness comes with prevention and patient responsibility. What can be done to help people help themselves?
Yeah, so first of all, I just put a plug, read the book, Trusted Healers, and it'll help you. There's questions actually to go ask the doctor. The next is know your numbers. Cleveland Clinic says, look, know these 6 numbers. So it gets into your blood pressure, it gets into your glucose levels, it gets into cholesterol, and whether or not you're carrying nicotine within your system. They also ask, do you have a primary care doc? Are you up to date on your vaccines? If your listeners right now are paying attention, I'm just going to ask, go get that flu shot. Don't wait. Don't wait. Because with COVID and the challenges that are out there today, it's really important that you stay as healthy as you can. And that flu shot's well tested and ready to go. So I'd make sure you're up to date on your vaccines, including the flu shots and other things. And if you're a little bit older, might be shingles. You got to do your shingle shot too. So I'm not trying to kind of be heavy on everybody, but you're asking me the question. And part of the answer is you got to get out there and go do it. See your primary care doc. Know what your numbers are. Take action to get your blood pressure down. Eat better and right. You know what that looks like. Try and get some of the challenge of that BMI going in your direction instead of the wrong direction.
Well, one of the things I know you also advocate is for the creation of a medical home. What exactly is that, and why is it so vital to healthcare?
Yeah, we thank you. In the idea of the patient-centered medical home, what it really is, it's a doctor's office, it's a practice, it's part of a hospital where your information is there. There's doctors and nurses and caregivers that can readily speak to you. They call you in for your mammograms, or they call you in for your annual physicals that you have to do. But it's a system, the medical home. It's not something that you bring to your home and unwrap and put up on the fireplace. We're talking about it's a place where your data is and where your caregivers are. And you have 7x24. And you and I were talking about telehealth and maybe being able to have those kind of interventions right now, given the situation where you have people that are thinking about you and caring about you and calling you. And that's what a medical home is, a patient-centered medical home. And we give definitions of it in the book. We give questions that you should ask your doctor as to whether or not they're a real medical home or not. And you want one of these. I'm telling you, you want to be in a medical home.
Well, I love questions, man. This show is really, really about questions. And since we're talking about questions, what are some questions my listeners should be asking themselves right now as it relates to the current health scare? And then what are some questions should they be asking their healthcare providers? Because let me just tell you this, over the last week, Dan, I went to my dentist, I went to my orthodontist, I was going to my DO yesterday, but I had a scheduling conflict. I went to my homeopathic doctor. So I have all of these people that are in my network, and I know my body, I know when I'm not feeling well. With what's going on right now, what are some questions should I or my listeners be asking ourselves or myself? And what are some questions that we should be asking our doctor? Because people are so afraid. I was watching CNN today, and they had a poll about, the vaccine. What do people think about the vaccine? And should I take it? Should I not take it? And then, in particular, when it comes to the vaccines, I know you talked about the flu shot. You have to admit there are people who are, in particular, people of color or disparate people or people who are poor, who are so concerned about vaccines and about, all these other things because history has not been on our side. So what are some things that I should be asking myself and also my healthcare provider?
Well, I'm going to start with what you just said about the flu shot. So I'll just ask you some questions. You can either nod and say it's a rhetorical question, or you can play along and try and answer for me. What do you think the first flu shot was?
When do I think it was?
Yeah, what year? It's okay. You don't win.
1919.
Close. 1930. 1930. Okay. When did the flu shot become widely accepted in the United States of America? Now, the first one's 1930. How long did it take before society said, okay, I'm comfortable taking the shot.
I think a very long time after that. I would probably say 50 plus years.
1945 is when it became generally available,
Mm-hmm.
and people could kind of make that decision. So I ask you that, and so how many people do you really think are going to take the vaccine?
Mm.
No one's talking about the human societal aspect of whether or not they're going to take the shot or not. They're starting to. Mm-hmm. But people are saying we're going to have a shot available, and every American's going to have it available. We're going to have 330 million available. You know, some of these shots, they require to be stored in 90 degrees minus.
Mm.
And do you know how many? You go to your local drugstore, you see whether or not they got a place to store that stuff. Ain't going to happen.
No.
Ain't gonna happen. No. And who's going to be the first ones that are going to get it? Hopefully, it's going to be our first responders and our caregivers, et cetera. So if you think about societal change, it gets down to us as an individual. History shows us that something like a shot, a flu shot, 48.5% of the population, last reported by CDC 2 years ago, took the flu shot. So if we use that as our benchmark, even with people running around scared and worried, but only half, that means that every other person you're going to come in contact with hasn't taken the shot. So it's kind of interesting to talk about, do we really think everybody's going to go get the shot? And the answer is society tells us no. Mm-hmm. And when it comes generally available is usually a period of time, not right away. It takes a while, because it not only takes a while to get it right and get the strain of the virus and what's mutated and not, and have it be exactly right, but then there's the logistics and where you store it, like I just mentioned to you. So with everything that I just said, some of your listeners might be more scared than not. Don't be. Do the right things. Wear the masks. Stay away from large crowds. When you have events, make sure people are social distancing, and then know your body, just like what you just said. If you start to feel a certain way, call your doctor. Go see the doctor. And don't leave this at the doorstep of the emergency room. Mm-hmm. Have this part of a continuum of care. Commit to yourself that I'm going to get healthy. I'm going to eat right. I'm going to do the preventative stuff. I'm going to go see a doctor. I'm going to know what my numbers are, and I'm going to be a role model for my family. Go do it. Go do it today.
So what are some things right now, Dan, with what's taking place across the globe is concerning to you? What keeps you up late at night as you think about the current healthcare system and the current health scare in the country?
Well, I think what keeps me up at night is what keeps other people up at night. When we have the real science that tells us certain information about wearing a mask and social distancing and things that we should do, and for whatever reason, people decide to go against that and then make their own personal decisions. And so for individuals like myself, it just suggests I'm going to spend more time up here at the lake and away from large groups than I am. I'm not anxious to get on an airplane because of that, although they're doing a good job, I think, better job now. I'm not going to go to any concerts. I'm not going to go to a football game. You know.
So you're not going to go to the Beyonce concert, man?
You got tickets? You got tickets? Hey.
Grateful Dead is in touring with Beyonce. Grateful Dead and Beyonce on the tour, man. Come on now. Bruce Springsteen just signed up too.
Yeah.
He said, "I'm not going to any concert."
Yeah, we're not. You know, and I love college football and some of those things. You know, and it's just sad. We're just working through it, and that's what we have to do. But you asked a really good question. What can the listener do? And the listener, stay away from those crowds. Wear your mask. Do the social distancing. Know your numbers. Know what it is. Have a relationship with your doctor. And you don't have to get in the car or get in a bus or call an Uber. You can do a telecall with your practitioner now, and it's not that expensive. Many of these things are being paid for today, and it's a different way, and it's a really good way if you'd like to do it from the comfort of your home.
So Dan, let's unpack your book. We mentioned your book, every so often. We talked about it. Why did you write the book? Who is the book for? and what do you want a reader to walk away from after they finish reading your book?
Well, thank you. I never thought I'd write a book, to be honest with you. But when I finished my work and had a chance to spend the time I did with great leaders, presented presidents and great healthcare leaders and others, and worked with Dr. Grundy and Dr. Michael Roizen and others that are just spectacular in their field, Dr. Glenn Steele, et cetera. I was encouraged to write the book. They said, you have a message to tell. And the book is about healthcare, leadership, and societal change, those three pillars. And you hear it through the voices of great leaders. You hear Oprah talking about in her last show, listen to the whispers, how important it is to listen to the whispers. Because if you don't, they turn into a problem. And those problems turn into a crisis. And then you have this disaster. How right was she? She did this in her last TV show. So I hearken back to these leaders that have influenced our society and have you hear their words that then you resonate with. Oh my gosh, they were so right. We do that with Nelson Mandela, who we worked with. We do with great leaders. Yes. And so in the book, there's the healthcare aspect about primary care and preventative care. There's these great leaders, and they all start, like you said, by asking a question. That's what how can we make it better? And then there's societal change. How long does it really take to make a difference? And from the good book to now, 1968, we lost Martin Luther King. 40 years later, we elect Barack Obama. 1928, a movie by the name of Wings is widely acclaimed. 40 years later, we put a man on the moon. I'm telling you, there's something to this generational aspect. And having families that are strong and passing on new traditions. Why not make healthcare a new tradition, this continuum of care, just like what you're doing for your daughter?
So I know we talk about U.S. healthcare, but we have to talk about Great Britain, how they favor their healthcare system, and Denmark. So explain to me, why is Denmark so far ahead of the world in primary care development?
Well, first of all, people are going to say, listeners, Denmark, it's only 5.5 million people. We're 330 million. But I'll tell you something. You grew up in Chicago, right?
Yes, sir.
So when you think about it, Denmark is potentially close to the south side of Chicago.
Yeah.
You know what I'm saying?
Yeah.
So we can learn and then implement things with like Rush and Children and Northwestern and the hospital systems that to the great city that would take care of people like you and potentially in that area. So we can learn a lot. What we learned is they had the continuum of care throughout 5.5 million people. They had the information about people, who the doctors are, whether people came in for their mammogram or they came in for their physical or they got their flu shot. And then they were progressively active in bringing those people in. And then when they got sick, they found the best doctor within Denmark that could take care of them. That's across 5.5 million people. 90%, maybe even more of healthcare is regional. So when we talk about trying to have a national healthcare system and do those things, most of us trust our healthcare unless there's some significant problem like cancer or others that we're going to a Mayo Clinic or a specialty or Cleveland Clinic. But most of us, we trust our care within the communities that we live. And so we can learn from big and small countries. In Denmark, they went forward with preventative care, the continuum of care, having your information, finding the best doctor for you, and then when you got sick, getting you into the right specialty. So we can learn from these places for sure.
Wow, just like I'm learning from you now. Dan, I just want to first of all, thank you for joining me today. It's been a breath of fresh air, learning so much. Listen, listeners, you got to go out and get his book. I mean, CNN, Dr. Oz, now in the bomb shelter with me is such an honor. Dan, how can our listeners get in contact with you? And then how can they get a copy of your book?
Yeah, thank you. So Trusted Healers, it's on Amazon, came out, #1 health book in health policy. And so you can easily get it every place you buy a book. And thank you for that. I want to conclude maybe with just one thing and the name of our company, Everyone Matters, because that's got some connotation. I started this a long time ago. I want to tell you why I started it, and maybe it's a good place for you to understand, at least from where I'm coming from. It sounds like where you're coming from. So I would have conversations like this, like you and I are having, with large audiences and small. I would be invited to speak on TV and appear with interesting people. I would finish our conversations by asking people a question. Why do we do what we do? And at first they would look at me with the stare of the Wisconsin dairy cow. What? And then I would answer for them, because everyone matters. And as I continued on this journey of trying to bring better healthcare and changing the systems and showing through the eyes and the actions of these great leaders that there is a promise of a better healthcare system, and that you'd look at it a different way, as my friend Patrick Kennedy says, then when I would finish and ask the question, why do we do what we do? They would answer the question, because everyone matters. And that's why the name of my company is Everyone Matters, Inc. And you can find me at everyonemattersonline.com. And I'm happy to talk to people and have an ongoing conversation. I hope you'll read the book. It's a quick read. People have liked it so far, which is nice. But it provides a service. It provides a service to individuals, to families, to communities. It gives great examples, questions to ask your doctor, questions about your health, your behavioral health. And I think people like the anecdotes along the way. So I've so enjoyed being with you. Come visit me. Come on. Come on up.
I will be there, because I know you are healthy. I am healthy, and I'm going to wear a mask, but I love the outdoors. And I'm sure it's beautiful around this time of the year. But Dan, again, thank you. But before you leave, one of my favorite parts of the show is called the Super Bomb Questions. And this is a fun part of the show where we get a chance to ask you some questions that listeners send in to us, because they want to know a little bit more about you. They know you've been on Dr. Oz. You've had these discussions and debates with people, but you're joining us here, so we're going to do it our way. So you ready, Dan?
Fire away.
All right, so here we go. So answer as quickly as possible. Here is your first question. Dan, what's your favorite word?
Yes.
What's your favorite quote, or maybe a Bible verse?
I like aspiration, inspiration, discipline, the way you should lead your life. Create an aspiration that inspires others, and have discipline for course correction and speed.
Love it. What's your superpower?
My superpower is being by myself and praying that I'm in the right moment to deliver what I should do.
What's your spirit animal?
I am a golden retriever.
What, I love that. What moves you to tears of joy?
Being around my children, specifically, and seeing them become who they are. I have great pride and joy in watching them become contributors to society and well-rounded.
What moves you to tears of sorrow?
Silence where people should have a voice.
What do you wish you had more time to do?
Make a difference in the world. I get up every day. I try and make a difference. I say hello to people, everyone that I see along the way, and just ask them how's their day. And I have wonderful stories of people that have touched me just because I said, hi, how are you? And recognize them. I wish I had more time to recognize people, because I think people are looking for individuals just to relate, ask, have a conversation, sit down. I wish I had more time to do that.
It's interesting you say that, because I have this thought that's always in my mind. Don't ask for a miracle, just be a miracle to somebody else. Because we are, during this time, we're leaning on one another. Final question. If you were in the Mr. America talent competition, Dan, what would your talent be?
A judge.
There you got it. Dan Pelino joined me in the bomb shelter. Pick up his book, listen to his conversations, check him out on all the platforms out there. You know, I love what he's doing, and it's an honor to have you here. Thanks for joining me today.
My pleasure. Thank you.
Now, I also want to thank my amazing engineer, Alexander Blanc, my super duper producer, love her so much, Nicole Klempaka, Supremacy, for our theme music. But I cannot do this without all of you. Thanks for listening. Make sure you subscribe, leave a comment, stop being stingy, share me with all your friends, and as always, believe something wonderful is about to happen, but some people miss the message because they're too busy looking for the mess. Thanks for tuning in, and do something for someone other than yourself today. You've been listening to Sound Bombing. Peace.